Tinel's test is a clinical examination technique healthcare professionals use to diagnose nerve compression or irritation, particularly in carpal tunnel syndrome. Named after French neurologist Jules Tinel, the test focuses on the median nerve and its possible compression at the wrist. A positive Tinel's test may indicate carpal tunnel syndrome or other median nerve compression or irritation forms. However, it should be used with other assessment, patient history and diagnostic tests for a comprehensive diagnosis. In addition to its utility in diagnosing carpal tunnel syndrome, Tinel's test can be adapted to evaluate other peripheral nerves for compression or irritation. Tinel's test can be used in scenarios like patient presentation, where the Tinel's test should be considered when a patient presents with symptoms suggestive of carpal tunnel syndrome or other median nerve compression disorders. Nighttime symptoms. If a patient reports that their symptoms worsen during the night, this can be an indication to perform Tinel's test. Repetitive tasks, where patients who perform repetitive tasks involving the wrist and hand, such as typing, using a computer mouse, or assembly line work, are at higher risk of developing carpal tunnel syndrome. Trauma. If a patient has a history of wrist or forearm trauma, it may be appropriate to perform Tinel's test to assess for potential median nerve compression or irritation resulting from the injury. And lastly, progressive symptoms, where Tinel's test can be useful in monitoring the progression of symptoms in patients with a known diagnosis of carpal tunnel syndrome or other median nerve compression disorders. Healthcare professionals who may find Tinel's test useful are physicians, orthopedic surgeons, neurologists, physical therapists, occupational therapists, and nurse practitioners. To use our free Tinel's test, follow these steps. Download our Tinel's test from the Carepatron platform, which you can find in the link in the description. Tinel's test is performed in a series of steps, gently tapping the median nerve at the wrist and observing the patient's response. Firstly, position the patient. Ensure the patient is comfortable with their forearm and wrist exposed, palm facing upwards. Next, locate the median nerve. Find the median nerve at the patient's wrist, approximately in line with the third digit. Next, tap the median nerve. Gently tap the median nerve using your fingertips or a reflex hammer. Next, observe the patient's response. Watch for any tingling, numbness, or pins and needles sensation reported by the patient. Lastly, interpret the results. Determine if the test is positive or negative based on the patient's response. Tinel's test scoring is based on the patient's sensations during the examination. A positive test is indicated by tingling, numbness, or pins and needle sensations in the ring finger, thumb, index, middle, and lateral half. A negative test suggests no compression or irritation of the median nerve, making carpal tunnel syndrome or other median nerve compression disorders less likely. Here is a sample of our Tinel's test, which you can find on our Carepatron platform. To find our Tinel's test, go to our Carepatron platform or click on the link in the description. In our template section, we have a variety of templates and worksheets for you to use with your patient. You can filter or type in the keywords to find the worksheet. Thank you for watching our video at Carepatron. If you enjoyed this video, give us a like. If you would like to see more videos like these, subscribe to our Carepatron channel or click on one of our recommended videos.